Welcome to Chelly's Nursing Review. When you open this door, you are on your way to a nursing license. Welcome to Chelly's Nursing Review. In order to start our very demanding program, there are some supplies you will need. And so as we talk today, I'm going to give you some introductory information and help you understand what you'll need to get through this course and to become a nurse. First, we will need to start with purpose. Is this your purpose in life? If it's not, don't sign up for my program, because this has to be a calling. When you get done with my curriculum, you will know the only way you got through it is this is your purpose, and nothing is too hard when you know this is your purpose. Inside this cup are highlighters. You will need an array of highlighters, ink pens, red, blue, your variety. I don't really care. Secondly, you will need to purchase some other supplies. The first is you'll need to believe. You will literally need to believe that you can do it. This is called positivity within inside of you. You can pick this up from the depths of your spirit and from the fact that you made it through nursing school if you're even looking at me right now. The next item on the list is you will need faith. You will need faith that if you came this far, he's not going to drop you now. For you can substitute God, Jehovah, Allah. It doesn't matter to me. Somewhere inside of you, you have to know there's a higher calling that you have faith in that is going to get you through this program and to your nursing license. Now, as you go through my program, we work closely with the software called NCLEX 4000. It is by far, after I've researched millions and millions and millions of different materials, this is by far the best. I like the rationales. I like that the software is set up for the test plan that NCLEX has for you to learn. I especially like how this software breaks down into subjects. So you'll get to know respiratory and respiratory only. You can master that before moving on to other subjects. So this is a software that I incorporate into the program to get you that nursing license we know you're going to get. Now, when we get started, you will be getting different modules, which will be based on the different test plan categories that NCLEX has. The number one category that students have very much trouble in is called basic care and comfort. For that reason, you will need to purchase a binder. This binder was designed by my student and now RN, working 9 to 5 Monday through Friday, Beth Bowler. She has designed it for you to understand how the items will be placed in my course. Even if you purchase the online programming, I advise this highly. In the binder will include your authority to test. Below that, you can even put your scheduled test date, unless you don't want anybody to know it, and then I'd hide it at the back of the binder. And then what Beth has done so nicely is she has put the schedule. She has made sure that she included a page for the Oh My God packet that you'll receive that teaches you who to see first and prioritization. She has included a folder here, a plastic cover for your medication packets. You will receive lots of medication packets from us. They will include the latest medications that you have to know. Beth is so wonderful in how she's designed this binder that she has included every single folder for the handouts that you'll be receiving from me. If you're in an online program, they'll be uploaded. If you're in the classroom setting, these will be handed to you as you matriculate through the course. such as procedures, and she has tabs for each one, and on and on and on. You have cardio, you have respiratory, you have geriatrics, you have your maternity and the like. You have all of these subjects that I literally cover in great detail. And that's what makes my course a little different. Each and every subject of the body and each category of the NCLEX test plan is covered in great detail. When you have completed my course, your binder that you purchased will look like this. This is how much material I give you, and this is how big and full your binder will be when you have completed my course. You will review every handout in this binder before you take your test, literally page by page, word for word, within the 2 weeks of your test date. So I suggest you prepare now your work schedule for the fact that you will not be working a week or so before your exam. It's just suicidal to think you can do both. This requires everything you got. Now I want to take some time and talk to you about the test plan. You've heard a lot about the test is changing. Well, actually the test changes every 3 years. And this test change is based on some concepts in a test plan. Now, my modules directly mirror the test plan. So the modules that Chelly's Nursing Review actually puts out and uploads into your account will mirror the actual test plan. For instance, you'll get a module that will be termed Management of Care. You'll have a module that will include physiological adaptation, which really is just another fancy way of saying body systems. You'll have a module that talks about infectious diseases, health promotion and maintenance, which really include maternity, pediatrics, and your geriatric changes in the elderly patient. You'll get a module that actually is entitled Psychological Adaptation, which is all of your psychiatric issues, including substance abuse. You'll get an actual module that will say, it'll actually say reduction of risk. That's a lot of information about procedures, vital signs, diagnostic tests. You will have to know those things, as you know, for the exam. You'll also have a module that will include the information that you would need for pharmacology. So all in all, you'll end up with 8 modules. I will have a module dedicated to basic care and comfort, because basic care and comfort, as I've stated before, is the most challenging category for most students. You will have to really understand what it is that you do that makes you a nurse and not a physician or a pharmacist. The nutrition that you would be advising, the positioning and body changes that you would have to know about, the mobility that you would encourage a patient to partake in depending on what their limitations are. You would have to know cool compresses for a fever or a tepid bath. You would have to understand that the answer for constipation is not a stool softener. It's increased activity. It includes pushing fluids. It includes a high fiber diet. These are all categories that you would have to really plan your study guide with, me helping you every week. Really plan how you're going to gain that knowledge in those categories. There's 8 actual categories that you'll get information about as to how to best prepare for this exam.